Hi everyone, my name's Cindy and welcome to Real Talk with Cindy. I decided to call this video Real Talk with Cindy because that's exactly what we're going to do. We're going to talk about different issues that occur in our lives, and we're going to be real when we talk about it. We face so many different things in society like anxiety, depression, eating disorders, weight control issues, the coronavirus. It's a lot, and a lot of people are afraid to talk about these issues, that people may think they're weak or weird, but you don't have to worry about me because I am very down to earth. I'm not going to ever use big words to make myself sound smarter than I am, the words that only Einstein could understand. I'm going to be real. Let me tell you a little bit about myself. I'm a 61-year-old wife, grandmother of 10, and a mother. I worked as a hospice nurse and a home health care nurse for many years. I'm currently not working, but we will get into that later. I am hoping that through my own life experiences and even my experience and education as a nurse, that I can help you with some of these subjects. I am not giving out medical advice. I'm never going to prescribe medication, so I don't want anyone to get the wrong idea. Any health issues that you have, always go to your doctor and discuss it with them. But I'm just going to be real with you, and I'm hoping to get some input from some of you. If you have any of the issues that we talk about, and you have anything that worked for you, or you have any information that could be useful, please, by all means, give it to me. Just because I'm a nurse does not mean I know everything. I learn things every day from my patients and their families. So one of the things that I'm going to talk about today is PTSD, and I'm going to give my own personal history on it because I think that when people are open and vulnerable, it can help other people that are open and vulnerable. Mayo Clinic lists PTSD as something that when a person experiences something very traumatic, or they witness something traumatic, such as rape, assault, any type of violence, war, it can result in post-traumatic stress syndrome. Some of the symptoms that Mayo Clinic lists are anxiety, depression, recurring memories of the traumatic event, fatigue, insomnia, social isolation, avoiding people or places because they might remind you of the attack, flashbacks, physical reactions to thinking about the attack. You may think about the attack or whatever the situation was, and all of a sudden your stomach's in knots and you're sweating and your heart's racing, your mind's racing. You can have physical reactions to remembering the event, emotional reactions, negative thoughts about yourself, difficulty with memory, lack of interest in things that you used to once enjoy, feeling emotionally numb, self-destructive behavior. A lot of people that have PTSD self-medicate with alcohol or drugs, difficulty concentrating, feeling shame or overwhelming guilt, feeling detached from family or friends, and being easily startled or distracted. These symptoms can progress over time and can become worse. My story starts about a year and a half ago. I was actually physically assaulted by one of my patient's daughter. I'm not going to go into the assault for HIPAA reasons, but it was very violent and it lasted 5 to 10 minutes. When I left, of course, I was hysterical. The reason I didn't press charges was because this lady was in the last journey of her life, and I didn't want her to go through it alone if her daughter was not there. But when I came out of it, I thought I was fine. I was a warrior. I was a nurse. I got up every day. I went to work. I did my thing. And then as time went on, things started to change. I'm not proud to say it, but my work performance was not where it should have been. I was still good with my patients and symptom control and things like that, but I was forgetting deadlines on compliance issues. I was forgetting simple things like getting on call. And you have to do that as a nurse so you know what's going on with your patients. I'm getting on phone call in the morning, morning call. Forgetting to order supplies, just little things like that. And then I started having nightmares about what happened to me. The reason I'm in my car right now is because I live with 4 other people, and 2 of them are children, so this is the only place I can have quiet, so that's why I keep readjusting myself. But anyways, so I started not being able to sleep. I was having terrible nightmares. I would actually be up 2 and 3 days in a row. Anxiety. I did not want to get up and go to work in the morning. And I love being a nurse, and anyone who knows me knows that I love being a nurse. Getting up to go to work in the morning was a chore for me. I also had physical symptoms, headaches. When I would think about the attack, I would get stomach pains. My heart would race. I would feel dizzy. I couldn't think. I would shut down. This progressed, and it kept going on and on and on. And I started getting socially isolated, where I wouldn't answer phone calls from friends, not go out to lunch with friends, because I might have to drive into the city, and that's where it happened out. And little things like sitting on my porch, which I love to do late at night and just relaxing, drinking a cup of tea, I couldn't do, because when I would be on my porch, I would think, what if someone jumps over the railing and attacks me or shoots me? If I would go to the store with my grandchildren, I would have to have them right by my side. I would actually put a 9-year-old in the buggy. That way I knew that this child was safe and no one was going to harm them. These are just some of the things that went on. As time went on, it got worse. It got really, really bad. And then I talked to someone on one of my managers at work who suggested that maybe I should seek counseling. So I did get a counselor, and I started, talking. Within 20 minutes, she diagnosed me with PTSD. So actually complex PTSD, because I had other issues in my life when I was younger, so it kind of built from that. Let me tell you, people, if some people are afraid to get counseling, it has really helped me. It's actually helping me to come back to being who I was before. It was bad. It was real bad. It would be sometimes my counselor, when we were still doing the telephonic sessions, would call me up, and I would just immediately start crying hysterically, and she would have to deep breathe with me until I could calm down enough to talk to her. I still haven't actually talked about the assault because I just can't go there. But counseling has really helped me. I've been doing it for about 6, maybe 8 months now. One of the assignments that I just did was I had to write a letter that would never be sent, but a letter to my immediate manager who knew about this, and I didn't feel like protecting me. I had to write a letter to her and tell her how I felt. That is very therapeutic. My counselor is helping me with coping techniques for when I wake up at 2 o'clock in the morning with severe anxiety attacks and I can't fall back asleep. So do not be afraid, people. Do not be afraid. If you have PTSD or you think you have PTSD, you can call your physician and you can ask them to refer you to a counselor who specializes in PTSD. At least if you're uncomfortable going to the office, most of them are okay with doing a telephone visit, and just at least see if you have it. And if you do, find a counselor you feel comfortable with. It may take 2 or 3 different counselors, but you will find one that you feel comfortable with. And when you first start off, it's going to be generalized topics and skimming the surface. But as you gain trust with your counselor, you can delve deeper and deeper into what's bothering you. There is hope, okay? There is hope. And it does not mean you're a weak person, you're a bad person. It's just your body's response to something traumatic. And there is help for you. Trust me, I still have a ways to go, but I have come a long way compared to when all this first started. I'm still not working. I can't even go there right now. But I'm hoping, my goal is to someday be able to go back to work, maybe not in the same capacity that I was before, but to go back to work. And let me tell you, before I plan on doing more videos on other subjects. The next one's actually going to be depression. But let me tell you one thing I am not. I am not judgmental. One of my pet peeves is people who judge. I've heard people use derogatory terms for someone who is facing addiction problems, calling them maybe druggies or losers. I don't feel that someone wakes up in the morning and said, guess what? Today I'm going to shoot heroin because I want to become a heroin addict so that I can ruin my life and possibly die and just upset my family. People don't do that, okay? I'm not promoting drug addiction, but there's always a story behind it. And unless you walk a mile in someone's shoes, you really shouldn't judge them. So I'm very down to earth, never going to use big words to make me sound smart. I'm going to be real. And that's what this is all about, Real Talk with Cindy. I welcome any of your comments, any advice that you have for me, and I will see you next time on Real Talk with Cindy. Have a great day, everyone.